Joining me now is a co-sponsor of the American Manufacturing Leadership Act and a member of the Select Committee on the Coronavirus Crisis. Congressman Bill Foster is a scientist, the only PhD physicist in Congress, and a businessman representing the 11th Congressional District of Illinois. Really appreciate you joining us, Congressman Foster. You know, we've talked before about COVID, about science, about manufacturing, but we're going to put it all together today. When Joe Biden came into the White House, he said the biggest challenge facing this country is COVID and vaccine development. How do you think he's doing right now on that challenge?
Well, it certainly remains the biggest challenge. There's a lot of room for optimism, but no doubt challenges ahead. Largely, I hope on the distribution side here. Unless we have major manufacturing hiccups, it looks like the vaccine factories will be producing vaccines in the quantities necessary for every American who wants one to be fully vaccinated in the next several months. And that's what we have to do. And then we also have a duty to the rest of the world. One of the lessons we've learned is that COVID anywhere is a threat to health everywhere. And so we have to make sure that the rest of the world gets vaccinated as well, for no other reason to prevent new variants from coming at us.
One of the seizures that America had when this pandemic hit was a kind of realization that it didn't have the manufacturing muscle and the domestic production capacity that it thought that it may have needed in a national security crisis like this. What does the American Manufacturing Leadership Act do to change that game a bit?
Well, one of the big realizations that we've had that we're going to be wrestling with for a while is a lot of the low margin, high volume manufacturing. They may be crucial in a crisis, but they are not high profit margin items, in the absence of a crisis. And I don't think anyone is happy with the idea that you just have to pay an arm and a leg for life-saving equipment. And so we have to manage proactively and with forethought this very careful transition from normal operation where we're maintaining stockpiles of the right equipment to the emergency situation where it's all hands on deck, and we have to use things like the Defense Procurement Act to really make sure that everything that's possible to be done is being done by the facilities in the U.S.
You know, one of the other discussion topics I've always fascinated by is the jobs gap in the country. I know you and your brother started a production company in electronic theater controls, and you're like one of the biggest, it's one of the biggest producers of electronic theater lighting and all of this. I imagine that's a specialized skill set that you probably need, people who know that world. I'm interested in the manufacturing jobs gap out there and whether or not we need to do more in workforce development than we've been doing.
Well, that depends on what industries you're in. One of the things that happens when our company, which I started the company with my younger brother with $500 from my parents in our basement, and it now has about 1,500 employees. Makes about 70% of the theater lighting equipment in the U.S. and exports roughly a third of what we manufacture. So it's really what we, a pretty good example of what we want to accomplish in American manufacturing. But when COVID hit, we were able to stand up a limited amount of manufacturing capacity for sort of low-tech items like face shields, things like that. And I think the problem really has to be separated between general purpose manufacturing that is part of a pandemic response and the much more complicated things like what's called GMP, good medical practice, I think, manufacturing techniques that you need for pharmaceuticals. That's not something that can be stood up by the average company. We have to plan that in advance. And even though the U.S. may not be the lowest cost place to make pharmaceuticals, generic pharmaceuticals under normal circumstances, we need to have that capacity. It's very much like financial services, where during the financial crisis, the observation was made that banks may grow globally, but they fail nationally. That when everyone pulls in, throws up the fences around their country and starts limiting vaccine exports, things like that, you better have the capability that you need from everything from N95 masks to the highest tech mRNA vaccines.
One of the other challenges out there right now that I know this act is in part trying to deal with is, I talked recently to Michael Dolston, who's the president of Worldwide Medical Research for Pfizer, and realized that while we've been a race, while it's been miraculous that we've come up with vaccine options, while they're getting in people's arms, this is kind of going to become a permanent global infrastructure, at least for the foreseeable future. There are real risks that COVID is going to be something that will continue to come in, as much like the flu will have to be dealt with variants and whatnot. And so that means, at least with both the U.S. production muscle and, as you said, exporting a lot of that product to other parts of the world that can't make it, I guess, do you think we're in shape and going the right direction to begin looking at this no longer as a race, but as a quick race, but as a marathon, and that we're going to have this manufacturing capacity in this country over the long term?
Yeah, and it's not just this country. It is unreasonable to expect any region of the world, be it North America, Europe, sections of Asia, to go without having that capacity to defend themselves from certainly new biological threats, whether they be natural or artificial. I think one of the things that everyone realizes is that while this particular pandemic appears to have occurred naturally, it easily could have been caused artificially. And we spent a lot of money on pandemic defense against what are thought to be the biggest hazard, deliberately created pandemics, basically biological warfare. But we have to really understand how to spend that money wisely. There's a lot of belief, for example, that we're spending a too large a fraction of our money on things like vaccines against anthrax, which is sort of last year's war or last decade's war. And so what we have to do instead is spend money on platforms that can be rapidly adapted to many different pathogens. And so making sure that that's driven by the best expert advice is really, I think, one of the things that Congress has to keep our eyes on, to make sure that when you do all the wargaming of the natural or artificial pathogens that can be coming at us, that we are appropriately prepared, both for the high-tech vaccines and therapeutics and the low-tech things like masks. And there's some lessons that we'll be learning on this. For example, that last point was appreciated in the Obama administration, who put out a design contract for a very, very high volume mask manufacturing machine, with the intention that we should make a bunch of these machines, have the machines in stockpile so that we could make large numbers of masks. And unfortunately, that effort was dropped in the last administration, not followed through with actually building the machines that the taxpayer had paid to have designed. And so we're going to have to just make sure there's more long-term thought put into this. And it's a challenge for a politician. If you're a politician in a democracy, you're mainly worried about what's going to affect the next election. Something that has a very small probability of having a big effect is not something that's on the top of your mind. And so we really have to heed the lessons from this pandemic and make sure we don't get caught short, and make the early and wise investments necessary to make sure that not only the North America and the United States, but the whole world has what it needs to defend itself by itself.
Well, Bill, you just succeeded in doing something that not many people do. The hair went up on the back of my neck. Got goosebumps as you were talking about small probability, big impact events, and the chances that in the future we could have a bioweapon or some pathogen of this sort decided. So let me just ask you, finally, are your colleagues aware of the framing you just gave this, that we could very well face with the technology we have today, something that is created to come in and to create a mass casualty event? Because you're talking about national security at a very different order than just responding to a natural pandemic.
Yeah, and the asymmetry here is that if you're going to, for example, stand up the capability for a nuclear attack, that's something that you can see from satellites. The footprint of a bioterror laboratory is one smart graduate student and a few $100,000 of equipment. And so this is, and once you establish if it's a contagion, you actually don't need that large initial set of equipment to launch the attack. And so this is something that we've been worried about for a long time. I mentioned following the anthrax events not long after September 11th, Congress got very worried about this, and we put a bunch of money into that specific threat. But I think that one of the lessons we've learned is that we need more general platforms to respond to threats more generally. And I think you will be seeing significant new investments there. We also have to invest in the set of experts that will maintain wisely and in a non-political manner the correct set of investments. As the technology evolves, we're going to be much more competent in responding to threats like this 5 or 10 years from now, simply because of all the incredible technology that's been developed in the last year.
Well, listen, Congressman Bill Foster of Illinois, co-sponsor of the American Manufacturing Leadership Act. I always learn from you. You really stretched this out in some new and important directions. Thank you so much for talking with us today.
Thank you.
That brings us to the end of our program today, but this was going to be Julia shutting this down. Would you like to take it over, Julia?
Why not? A big thank you to the National Association of Manufacturers for its support of this program, and to all of you in the audience for joining us. And a big thanks for Steve Clemons for joining me in the studio today. For those of you who missed any of the conversations this afternoon, we will have the video up from the event on our website shortly. I'm Julia Manchester. Be well.